And what about like with heart racing? If their heart rate, if they feel like their heart rate is increasing, what would you recommend for that? Because I hear that from time to time. It felt like my heart was racing a little bit, or my heart rate went up. What would explain that?
So we're getting into, all the arrhythmias, whether it's an inappropriate sinus tachycardia. We've seen lots of that post-COVID, for example. Or are you flipping your rhythm? Are you going into atrial fibrillation or an SVT, or is there something else going on?
Mm-hmm.
I would like to think that the patches are going to improve heart health in a way that does stabilize rhythms over time.
Mm-hmm.
We don't have a research result to really demonstrate that,
Mm-hmm.
although I think it would be very interesting.
Well, maybe that's
It's gonna,
something
it's
you
gonna
and
be hard
David.
to it's gonna be hard to really accurately predict what happens to any one rhythm in an individual,
Right. Oh,
based on what we know right now.
and maybe that's something you and David could get into when you have your conversation on the studies.
Oh yeah, be so exciting.
I know. So
Mhm.
I want everyone to know that Dr. Kneller's information is up here. If you have further questions, like he said, his natural heart doctor, that information is for his telehealth. And then the Lakeside Heart and Vascular Center is a one-time in-person visit, and then after that, it can happen online as well. So if you want,
Yeah,
yeah, they can contact you through either of these facilities. Is that correct?
if you want a formal meeting and evaluation, those are
Yes.
both appropriate. If you'd like to email me and just ask questions and stuff informally, I'm very open to that as well. I want to be a part of this community and available to people. But if you'd like a formal eval, one of these two channels is the way to go. Otherwise, questions and comments, I'm happy to answer emails and just connect with people individually.
Well, that's fantastic and very generous for you to offer that. But you are a cardiologist and you're very busy. And so if someone does have heart issues or conditions, I highly recommend you actually do a formal evaluation and have him take a look at what's going on a much grander scope, minus, versus just sending a quick email and expecting a quick answer without a full evaluation. I know there's a lot to someone's health and what's going on with them and their heart and many other things as well.